Hi, my name is Dr. Dirk van der Spy and I'm an orthopedic hand surgeon practicing in the southern suburbs of Cape Town. Welcome to Cape Hand Surgery. Dorsal wrist pain is a poorly understood condition, and patients typically present with a deep aching pain when they load the wrist in hyperextension, typically like doing the chaturanga movement in yoga, doing push-ups, or even doing heavy weights above the head. The force generally in hyperextension is causing the pain, and this condition has been very poorly understood. There has been thoughts about small little ganglions causing it, and now there's also a new understanding that this actually might be caused by a ligament insufficiency or ligament weakness that change the dynamics of the wrist. The pain is typically seen around this area of the joint, and this is very much correlating anatomically to the scapholunate ligament. So if that is the position of the pain, and the normal anatomy is the radius, the scaphoid, the lunate, and in between is the scapholunate ligament. Our understanding today is that the mystery might be a weakness of the scapholunate ligament, and with that might be an associated small ganglion that might cause the insufficiency, or maybe be a flag that there is a ligament insufficiency. We still don't know. There is a new concept that the missing link for dorsal wrist pain might be caused by a newly identified anatomical structure called the dorsal capsular scapholunate ligament. Now this little ligament or tether, or almost just a very thin membrane between the dorsal part of the scapholunate ligament and the capsule, might be the reason why you've got wrist pain. When this ligament tears or is insufficient, you're going to have more movement of your lunate and might cause impingement in the loaded wrist extension. When we look at this diagram, we can clearly see, if this is intact, showing on this x-ray, that in hyperextension this will prevent the dorsal part of the lunate impinging against the radial rim. On this diagram, this is what we typically would see in patients with ganglions and with dorsal wrist pain. This is the posterior interosseous nerve running right over in this area, and we think that also irritation of the posterior interosseous nerve can cause this discomfort. This is where the area where the ganglion is, but here we can see the wrist ligaments just look weakened by this ganglion type tissue, which might be associated with a weak dorsal scapholunate ligament. What we see in this case is the little ganglion. The ganglion has got a stalk coming out of the scapholunate ligament, and essentially it can be seen that this scapholunate ligament doesn't contain the same good quality of a ligament that we would like to see or expect, and this mucoid or weakening of the ligament might then cause this little ganglion to arise. This image shows a very interesting part. There's the scaphoid, there's the lunate, and there's the ganglion. And next to it is an area of exposed cartilage, showing that this instability of the ligament might actually force the lunate into a position where there's no cartilage, and this might explain why people have got pain. So our understanding currently is that dorsal wrist pain might be caused by many reasons, and it's sometimes best to have it checked out, as there are many rarer causes of this. If you experience pain in loaded hyperextension, it might be worth to have this checked out. Sometimes we have to do an MRI to confirm the diagnosis, but it is best to have these fixed, as they typically don't get better. Please feel free to come and see us if you're battling with pain in loaded hyperextension. Thanks for watching, and please feel free to visit the website at www.capehandsurgery.co.za or follow us on Instagram or Facebook.